Hi, I'm Dr. Varudhini Kankipati and welcome to Mangat. We're going to spend some time and talk about the effects of pandemic on mental health. This is unprecedented times and we have nothing to draw from our past experience. So it is a time that we fear the virus and also a lot of uncertainty. This uncertainty comes with a lot of stress, and this stress can be visible everywhere, and particularly for certain groups such as frontline workers, essential staff for both government and public, daily wage workers and small businesses, elderly population. And if you really think about it, this fear and uncertainty is basically the basic atmosphere of everything. When the whole society is down and feeling uncertain and everyone's very vigilant of what is happening and being careful, we tend to also get that way. This is going to manifest in the way we are sleeping, our sleep patterns get affected, eating patterns get affected. We don't know how to spend our time sometimes, or we're just working all the time. So what happens is everyone gets affected in different ways. So you're not alone if you feel this anxiety and fear and uncertainty. When we think about families, it's not only the traditional family of mother, father, and children. There are different types of families. So the first one is when you are living alone. And one of the effects of the pandemic is the isolation. And isolation can really start to get to you. A lot of people are struggling to have a work-life balance of knowing when to stop and when to do other things. So when you're in isolation, you think, okay, I'm alone anyway, might as well continue working. But that does affect your mental health. Another area is the lack of socializing ability makes you not knowing what to do with your time. So you would either watch too much of Netflix and binge watch and then feel guilty about it, or you are at a point now where you're like too tired of Netflix and you don't know what to do. Continuously, day in and day out, it almost seems like you don't know if it's a Monday, Friday, there's no distinction in the days. So the next dynamic of a family would be a mother, father, children, grandparents, or an extended family living with you. One of the effects of pandemic with that is there's no space. There are too many people living under one roof and you don't have that personal space. And then you will realize that past issues that you were coping with by going to work and coming back, you can't do that. There's no space to get away and feel and think differently and come back. Everyone's personalities are different, everyone's needs are different. Those past issues that you had an issue with and you learned how to deal with and kind of sweep it underneath the carpet, now they're up and forefront. The third type of family is the working parents with children. If two parents are working, they have to work, they have to maintain the house, they have to be there with the children. They're so stretched for time that they don't know what to do. They don't know how to balance this. They have huge amounts of guilt because when both of them are working, who's looking after the children? Mostly they're on their gadgets. So parents have a huge amount of guilt because they don't know how to be there right now for their children because they can't, they have to work. Children process things very differently from adults. We need to understand that children don't have the conceptual understanding how to deal with this pandemic. When you tell children, well, you need to be careful, you can't go out, you can't do this, they really can't comprehend what does that virus mean. So instead, what children mostly end up doing is they look at you not allowing them to go play or go down and meet their friends as a form of punishment. Children's routine has turned upside down as much as yours. And they also don't have their own space to do their own thing and have getaway time from their parents. So they're in this as much as you are. So this is an uphill battle for the child and also the parents. So the question now, parents, is what are you going to do? First thing is strategize. Both mother and father need to sit down and think about what they can do to kind of help the child through this process. The second thing is talk to the child and ask your children, what do they know about the virus? Are they worried about it? They need information. They need to be told a little bit about what is going on, because they do know that something's not ordinary, something extraordinary is happening around. You need to sit down before and say the virus can be everywhere. You need to educate the child a little bit. And you need to also tell the child, don't be afraid. We just need to take the precautions. So when you're talking to children about uncertainty, you also have to give them the reassurance that things will be fine. One area that most parents, I feel, are struggling with is the amount of time that children are on their gadgets. But when does that become a problem? Is when the child's health is deteriorating. If they forget to eat meals, if they're not able to sleep at night, if they don't want to do anything besides being in their room, socially isolating themselves, only playing on the gadgets for hours together. And when these red signs come up and you are not able to take away the gadget without the child having a tantrum and rage, then you know that, okay, I need to be able to get more help because I'm not able to deal with this situation. What helps with children is when they fall into a form of a structure. So keep to a structure. Make sure all the children get up on a certain time, they go to bed on a certain time, they have chores and responsibilities to take care of. And this means all age groups of children, right? There is no child too young without doing something to contribute to the functioning of the house. This will help them to have something to do. It also makes them responsible because the family is a structure that needs to function. And when everyone contributes a little to it, it makes it smooth. The burden doesn't fall on one person, and everybody respects and understands that they work together to feel like a family member to run the family. Another dimension that affects children greatly is when in families there are arguments. This is inevitable. Every couple, every family member get into arguments. And because of the confined space, it's more likely that fights will happen and disagreements will happen. If the children are very young, this is very important that you learn to fight in a respectful way. The child starts to look at the parents who are fighting or their older sibling fighting with the parents. They need to learn how to do it correctly. So fighting is good when it's done respectfully. And if it's something that is not needed for the child to hear, please take that conversation to your bedroom. What they need to know is that when you have a disagreement, the way we treat each other means a lot, and that is what you will help the child to know how to work with their own disagreements, and when they feel angry, how to channelize that. Hi, I hope you like this segment on effects of pandemic on mental health. If you did, please do like, share and subscribe to Mangat.